Welcome to Sutures and Cents, where Tegaderm meets Top Line and Surgiflow meets soft costs. In ambulatory surgery centers and hospital ORs, we talk clinical to business people, and we talk business to clinical people. I'm Mark Copeland. He's Ryan Pistone. We are Sutures and Cents. Ryan, on today's episode, we get to talk to Emily Spooner, who is the CEO of the South Florida Same-Day Surgery Center in Pompano Beach, Florida, or SoFlo, as she calls it. And she, to me, is a fascinating individual in healthcare, and I think we probably need more people like her. Here's how I would describe her, Ryan, then I want to hear what you say. She is human, and I think you'll see what I'm, to anybody listening will understand after you hear from her. She's a non-clinical person owner, which you're allowed to do in Florida. She's not above any job. She sings for her supper every day with her surgeons and her patients. And she actually turned a bar into an ambulatory surgery center in Omaha, Nebraska. I cannot imagine anything more interesting than that. What do you think, Ryan?
I even think she said it was like a really old bar, so it probably looked awesome. Probably a lot of exposed brick. The simplest way to describe that, the conversation with Emily is she's a good person who cares. Right? She reminds me of like if you told me that Emily bakes like cookies for old people and brings it to them on the weekend, I'd be like, oh yeah, that makes sense. Like she cares, she gets it. And then she takes that caring and she just applies it to work.
Yeah.
And then what's fascinating is the results, right? Which we're going to cover when we talk to her. So
yeah, I love it. Let's talk to Emily Spooner of the South Florida Same-Day Surgery Center, or SoFlo Ambulatory Surgery Center. Okay. All right. So we're with Emily Spooner, and we talked to her about Emily and a little bit of her background in the introduction. Emily, actually, one of the questions I had was, I noticed on your resume that you have risk management services and inspirational motivational speaker. How is that possible in one human being? That doesn't seem right. But you can tell us about that, or you can just tell us how you got here, how you are now to the point where you own an ambulatory surgery center in Pompano Beach, Florida. Tell us your story.
Well, I did not start out in healthcare whatsoever. I did not plan on doing anything with healthcare, but I worked in engineering. I worked for Union Pacific Railroad. I got laid off when my son was a brand new baby. And I went to my OBGYN's office for my postpartum visit, and I told him that I was without a job. And he brought me back to his office manager and said, she's one of the smartest women I know. I barely knew him. He was my doctor. But he hired me, and I worked for him for 17 years. And he was my best friend, and we really were able to grow his business exponentially. So I started out at the front desk as a medical receptionist because I had the Spanish speaking skill. Mm-hmm. And within 6 months, I had my own office and I started scheduling his surgeries. And so that was where surgery just kind of became an obsession for me.
What attracted it to you? Like, are you to it? Was it just the organizational part, or was there something even more about it?
Gosh, I really fell in love with my patients. And it was all about providing the best care. And I totally got all of that vibe and that spirit from the surgeon that I worked for, because that's exactly how he was. And that all rubbed off on me. And he taught me every single thing that I know about medicine and about ambulatory surgery. We opened it together and it took us years, but never having any kind of experience with any kind of building or anything like that, learning all of the codes in all of these multiple different states that I've done now. Yeah. But Nebraska, it was, I look back at it now and I was like, I had no idea what I was doing.
Well, you've opened them in Nebraska, Texas, Florida. I don't know if I don't think I missed any. What was Nebraska harder than those other two? Easier? Like, what's your sense of that?
I would say Nebraska was easier than Texas is probably the hardest.
Really?
Texas code.
Code?
It's a little bit different than maybe the regular, you have to go by the highest standard. So if that's CMS or if it's Texas code, I think Texas health and life safety has some higher standards specifically to CMS.
When you, right, because I'm assuming, looking at your history, when it comes to opening that surgery center, the first one, were there a lot in Omaha at that time, or were you the first, second, third, like early on? Because I just knowing the market, there weren't a lot of surgery centers, and there's kind of been a boom. So
Yeah, no, I only knew of maybe like 3 or 4 other centers at the time. I think there were possibly more, maybe plastics or some office-based surgical suites that have been around for a long time that we just didn't know about. Ambulatory surgery in the state of Nebraska and Iowa and that area just really isn't a thing. Or it wasn't, definitely wasn't when we first started this. And they said that they were going to cut off the number of ASCs at the time. Literally, I had just had a huge surgery in my arm and everything. And I'm driving to Lincoln, Nebraska to turn the paperwork in because they were going to cut it off at a certain date of applying for a license. So before we even knew what we were doing, we were like, okay, well, we just need to put our paper in. We didn't even know what that meant. But,
I love it. I love it. So you guys get that one started. I think, did you say did you have a couple more associated with that practice as well? Or is it just the one?
The urology practice, I kind of started there. I worked there in surgery scheduling, and they were just opening when I first started. And I did that to learn about how to open ours while it was under construction. So because it was actually a bar, and we turned it into an ambulatory surgery center. It was the coolest old historic building, so we had to do a lot of work in there.
Yeah.
So it took a while. It took like 4 years to get open. But It was a very interesting project, and during that time I was able to learn a lot from the urology center that had just opened.
That's smart. Is it still open to this day?
Yes, the urology center is. My surgery center is not. And that's a story for another day.
I kind of hear the sadness in your voice. So
when COVID happened, let's just say a lot of things changed.
Yeah.
And that's why I no longer live in Omaha.
Yeah. Well, so you ended up being an administrator of South Omaha Surgery Center, right? And then you end up doing it as a consultant, it looks like, an interim administrator in North Texas, and then back to North Miami, Florida, right? Like Miami Beach, Florida, I should say, at North Miami Beach. And then you opened South Florida. When was that? That was last summer, it looks like. So a little over a year ago?
Yeah, so I purchased the property that had been a previous ambulatory surgery center. It was closed for about 2 years during COVID. And so I was approached, and I had a really amazing opportunity of, Emily, we know you can do this, so you can get our surgery center open and we will be able to provide some partnership for you. And so it was really a fabulous opportunity for me. It was the perfect opportunity for me.
And the people that approached you, money
Business folks.
People or surgeons?
Business people, not surgeons.
Wow, interesting. Okay, yeah. So you said, I think I heard it on the Becker's podcast that you were interviewed on. You said something, I was laughing. You said that in the state of Florida, a non-clinician can own an ambulatory surgery center. And I said, I thought to myself, that's interesting. I didn't know that. And then I also thought to myself, that means non-clinicians can't in other places. And I didn't know that either. So tell me about that. Like how does it's pretty interesting to me.
So the doctor that I worked for in Omaha, he really wanted to be able to bring me in as a partner, but you cannot in the state of Nebraska and almost all of the states. unless you are a healthcare provider of services. In the state of Florida, it is different that you can be a business person and open an ambulatory surgery center. The thing is, I don't feel like I'm just a business person. I was able to develop those relationships and learn, and I studied with this surgeon for 17 years right next to him, transcribed for him. I saw patients for him. I went back to school and learned how to scrub for him. I did all of these things to be able to learn sterilization techniques. And I was in the state of Nebraska considered a scrub tech because you just had to have 2 years experience and a certificate. So I was able to do that. And I feel like I am a clinical person because that is so much of what I love to do, and being able to participate in that patient care. And so I think that gave me definitely a leg up on others that maybe are just business people to be able to open a center, because I was able to I can do the sterilization. I can do the assisting if need be. I can set up trays. I can do all of those things to be able to keep those costs low in a private practice setting, to be able to become profitable before you're profitable. You know what I mean? To be able to make some money by working every single part of that job. And I really feel like that helps with employee engagement and it helps with your surgeon engagement, because if they see someone that's an owner of a surgery center getting down on their hands and knees and scrubbing and terminal cleaning between cases and taking out the trash just like everybody else, honestly, the surgeons don't recognize me when I'm dressed like this, because every single surgery day I'm wearing scrubs and I am right alongside them. And those are my favorite days.
That's really, really, maybe there's other people out there like this, but I think I picked up on this when I was reading things you were writing. It was being published in Becker's. And I think that's what made me reach out to you, because I was like, wow, she doesn't sound like what other administrators sound like, like it was, and I mean that as a compliment.
Thank you. No, it is a compliment. Thank you.
Yeah. So there's two topics I really want to cover with you, and I don't, know what questions Ryan may have for you, but I'm really interested in. I'll tackle the bigger one first, which is, you own this ambulatory surgery center. You came from a place that's one of the bigger ambulatory surgery center organizations in the country, right? And you've seen how big ASC business works. You're now a private owner of this. How do you see yourself competing against established infrastructure?
Greatly, because there's so much opportunity out there. With the large corporate, the patient care is not the focus. And I probably will receive lots of backlash about this. But having had that experience in 17 years in private practice, which we did have 19 surgeons at one point, but to a large corporate where it just felt so much like a factory. And I received so many patient complaints that it really touched me. It really made me want to make a change and do something better for that patient community, that is not just, oh, your insurance isn't going to pay. We're going to make you sit here and you're going to wait until that insurance approves it. That's not a way to treat a patient. Let's provide better quality care, whether or not their insurance is going to pay, whether insurance is not going to pay. Let's provide them the care way before they are arriving. Let's do things better. There's so many ways that we can improve this patient care. And it's not just about numbers and about, patient satisfaction scores, or about employee engagement, or about putting someone in that space as an admin to just do what they're told. It is about actually making a difference in healthcare. That's what's important to me. That's my whole goal, is to be able to actually make a difference, not just be a placeholder for someone else or 67 other people to tell me how to treat my patients.
Well, it's funny. I think some of those patient engagement, patient satisfaction, though, if you have the attitude that you're espousing here, and your facility has that, those things tend to sort of take care of you themselves.
Yeah.
Like you almost don't have to worry about
Absolutely.
them because you're worrying about them, if that makes any sense. Yeah.
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 If you just treat
So
people right, it's amazing. They'll say nice things about you.
Yeah, and they respect you. And I mean, I had a patient call me on my cell phone the other day. She's like, "Are you sure that it's okay that I?" Absolutely. I want to make sure that you're okay. That is why I'm doing this. It is not a volume and a numbers game for me. It is about quality healthcare, one-on-one healthcare.
how do your so if you're sitting in front of a group of surgeons, I suspect you talk the same way to them as you are to your patients, and that you are to us right now, is my sense from having this interaction with you for the past
Yes.
couple of minutes. Um, what? How do you get them? How do you get them to you, or how? What are they? What are they coming? Because you said, and we'll talk about social media in a couple minutes. You said the social media was interesting because you're finding that surgeons aren't looking for ambulatory surgery center healthcare information on social media. I think is how you described it. So how are you engaging them, right? Because they're the ones that bring the patients in many cases.
Well, they are on social media to kind of get away from surgery sometimes, I think.
Mm.
To get away from that patient care, from the research and things that we've done. But so I've gone to private practice. I'm targeting specifically private practice surgeons that have an excellent reputation for high quality patient care and that are completely focused on their patients. I have a spine surgeon that I spoke to prior to the Becker's podcast because I wanted to have his opinion about what was important. And the patient centricity was the utmost important to him. And so I'm looking for those surgeons that jive with me, that want to work in a facility like that, that is not corporate. And there are lots of surgeons out there. There really are. There's
Yeah.
more than I thought. So,
Well, and if you don't need a hundred of them. You need an X amount. You probably know the number in your head that buy in, that are happy. I mean, buy in metaphorically, not literally. I mean, like buy in that this is where I want to be. I can get my block time. My patients are treated well. My patient, Ryan, we've been there. Like as reps in the OR, of how many times someone has come in and said, "Oh yeah, the patient was complaining to me, the surgeon, that somebody out front said did something," or like, and it ended up being a reflection on the doctor, even though the doctor, like,
right.
he or she's at the hospital. They're not like, they didn't do that. And,
Mhm.
to be able to have patients come to a place where they know from the minute they walk in to the minute they're wheeled out or walk out, like, it's a great experience. That
It's a
is
great
extremely
experience.
valuable. Um,
And the surgeons appreciate that. That's where they want to take their patients. When they know that their patients are going to get the highest quality care and that even the CEO or owner is going to be right there and provide that care and walk them downstairs and wheel them outside and do whatever in the heck that I need to do to be able to, not just because I want a great patient satisfaction score, but because I have personally had a lot of things done in ambulatory centers and I know how I want to be treated as a patient, and I know how they deserve to be treated as a patient. And word of mouth in this business, and especially in South Florida, is worth more than anything.
hmm, hmm. How do you every how do you how do you show what you just described? I'm in sales. I can sit here and say, listen, ours is better. It's better, whatever it is, right? But you have to show it. You have to present it, explain it, demonstrate it in some way. How do you demonstrate that to those doctors?
To the surgeons? Well, I mean, one of the things that we do every single month on the fourth Thursday of the month, and any and everybody is invited, we do a networking event. So I want all my surgeons to come and spend time and have a great time and have a drink and have food and just be treated by me. And we talk about things that we can do to make improvements. And my staff is invited, everyone's invited, and this is what we're trying to make our center better and their care better. And they bring that they're able to be a lot more open. My medical director also is from Trinidad, very laid back. He wants his patients to be happy. And I think that they just appreciate seeing that in me and seeing the service that I provide to them as surgeons and treating them as a normal human being. I think that they honestly, truly appreciate that. And they enjoy having a good time once in a while and not having to talk constantly only about surgery and what the rules are and what the regulations are. And I'm going to hold you to this. No, let's have a conversation about it. You know, let's have a real conversation. I'm just going to be real with you, and I want you to be real with me. I think they appreciate it.
Oh, I can't imagine that they don't. And I would imagine a happy customer. What's the old rule? There's an old rule, like a happy customer tells one other. You know, an unhappy
Right.
customer tells 10, something like that, right?
Mm-hmm.
But like all you need is a couple of people that are like it and are happy and say, hey, you're complaining about your block time. Why don't you bring it over to here? This is where I go. You know, you can't have my block time, but
All right. So that was a great first half interview with Emily. We'll have the second half coming out in a couple weeks. But, you know, my big takeaway really was that she legitimately cares, right? Which is, you know, everyone should do, right? We talked about it in the beginning. But, you know, she legitimately cares. Everyone who she works with sees her as a shining example. They care, right? They find doctors specifically who care, right? They're not just taking any doctor. They have to align with what their ASC is trying to do. And then, as she pointed out, everything else just kind of takes care of itself when you're nice, when you show love towards your patients, when you treat them actually like people. Your surveys get better. You get referrals. Doctors want to come work at your surgery center. I mean, like that was my big takeaway. And if I don't know if it's possible on a massive scale with hospitals, but that's definitely something every ASC can be doing across the United States and should be doing.
Well, agreed. I mean, it's healthcare, right? And you would think that more people would say, smile, be nice, take care of people. And we all sort of inherently know it. But when somebody like Emily talks about it and then lives it, you start, I mean, I don't know about you. I was sitting there going, am I doing enough of that? You know, like,
no.
And you're right. The answer is probably not. And what I also take away from it is that I think she's pretty savvy. Like, I think she understands that good quality care and love and appreciation of your surgeons, appreciation of your staff, that your patients matter, is good business, even if that's not what you're saying it is. She's saying you do it because that's what you're supposed to do. But I think she's proving it's good business. You know,
Yeah.
and I'm fascinated by it. I am fascinated by her.
I mean, I couldn't agree. Like, it's just when you see those small businesses and you go like, oh, why does everyone go like, we'll make a fictional thing, but we all know like a business like that. Like, oh, why do you go to that bakery? They're the nicest people on planet Earth, right? They messed up a cookie order once and it was my son's birthday and they did like, and you're just like, I'll be a customer for them for the rest of life. Right.
Right.
And like, that's I think common outside of healthcare, and she's making it common in healthcare, at least at her facility. And
I agree. We should both be applauding, and we need one of those fake applause tracks, Ryan, that we can put in here.
I think I can add that. I think I can add it at the end,
or we could just do it ourselves, because then fake would be sort of what she's fighting against every day.
Yeah, that's true.
Yeah, I really enjoyed it. I can't wait to hear part 2. Till next time. So, you know, the saying, all bleeding stops eventually, applies to both surgical patients and healthcare balance sheets. It sort of almost seems a little inappropriate after talking to Emily. Might have to shelve that one for a little while, but
we won't use it on the next one.
We will see you next time on Sutures and Sense.